Welcome to The Explainer. So today we are going to break down how artificial intelligence is about to completely reshape what it means to be a doctor over the next 10 years.
And this really gets to the heart of it. Think about this question for a second. We're not just talking about getting a few new gadgets for the clinic. No, the next decade is going to fundamentally redefine your role, taking us from what we know today to something, well, something straight out of science fiction.
So the next big phase is something experts are calling deep integration. And forget about toggling between your EMR and some clunky AI app. Imagine an invisible, intelligent layer that's just there. It's constantly analyzing, predicting, and alerting. It's basically a central nervous system for the entire hospital.
And this all leads to the big idea, the main takeaway for this whole evolution. Your job is going to shift big time. It's moving away from being a data processor. You know, finding labs, calculating scores, chasing down info, and it's moving toward being a data interpreter. You're the one who makes sense of it all, who verifies it, and who puts it into context for the actual human patient.
All right, let's start with the near future. Think 2026. Here your role is going to look a lot like an airline pilot. You're not flying the plane on gut feeling alone, right? You're the final authority, the expert in the cockpit, verifying that all those incredibly sophisticated instruments are telling you the right story.
Let's make this real. Imagine a patient with metastatic renal cell carcinoma. You know the drill, digging through years of records to manually calculate an IMDC risk score. It's tedious, right? Well, now that's done in seconds. The AI does all that scut work, which frees you up to do what you do best, confirm the findings and actually strategize the treatment plan. And in critical care, this shift is even bigger. In the old days, you see a lactate of 14 and you just think, okay, that's bad. But now, AI gives you this whole new dimension, velocity. Seeing that the lactate clearance has slowed to just 7.1% tells you something way more important. It tells you your patient is stalling out, that a metabolic crisis is brewing under the surface, even if that absolute number looks a little better.
This quote just nails it, doesn't it? AI is reframing the very questions we ask. We're moving beyond these static snapshots to really understand the trajectory of a disease. And that means we can intervene with so much more precision.
So here's the bottom line for 2026. You are the validator. You're finally free from all those manual calculations. But your clinical judgment, it's more important than ever. Is that AI alert a genuine crisis, or is it just a lab artifact? You're the one who has to make that final context-aware call.
Okay, let's jump forward a bit to 2030 and see where this is all heading. As these tools become seamless, you evolve from a pilot who verifies the instruments to a proactive orchestrator, someone who's conducting an entire symphony of care.
And the impact here is just, wow, it's staggering. Hospitals that are already using these AI-driven early warning systems, they've seen up to a 25% drop in code blue events. This isn't just a theory anymore. This is really happening. It's a proven shift from reactive to proactive medicine.
This completely changes the whole rhythm of a hospital shift. You know that frantic sprint to a code? That's replaced by a calm, purposeful walk to a patient's bedside. All because your AI dashboard flagged a subtle little risk spike an hour ago. You're not just putting out fires anymore, you're stopping them before they even start.
And your role, it gets bigger. It expands way beyond just direct patient care. You're now the conductor of this incredibly complex system. You've got robots handling lab transport, algorithms flagging at-risk patients, and you are the human hub at the center of it all, making sure every piece works together perfectly. So now, let's look even further ahead, to 2035. This is where the evolution really hits its peak. With the science part of medicine getting more and more automated, your role elevates again. You become both an architect of your patient's health and, just as importantly, a uniquely human healer.
The key piece of tech that makes this happen is the digital twin. Get this, at admission, a super high-fidelity virtual model of the patient gets created. It's got their genomics, their clinical history, their real-time vitals, everything. This is a concept that's coming straight from advanced engineering, and it's about to revolutionize personalized medicine. What this means is, before you ever give a single drug, you can test dozens of treatment protocols on your patient's digital replica. You can see which chemo regimen is going to work best, predict the side effects, and design a hyper-personalized plan with a level of precision that we can barely even dream of today. You're literally building the path to recovery.
And you know, when the system is handling all that immense scientific complexity, your focus gets to shift to the true art of medicine. When an AI tells you there's a 15% survival probability, your most critical job isn't the calculation anymore, it's the conversation. It's not translating that cold, hard data with real empathy and guiding a patient and their family through an incredibly human decision.
So let's put it all together. What does this whole evolutionary path really look like? Well, you can see it's a clear progression, from hands-on work to high-level orchestration, and finally to deeply human guidance. This table really sums up the whole journey. In 2026, you're the verifier, basically double-checking the machine. By 2030, you're the orchestrator, preventing disasters before they happen. And by 2035, you're the architect, simulating futures in a computer and handling those tough, uniquely human decisions that a machine could never, ever make.
Which kind of leaves us with one final big thought to chew on. This whole tech wave, it isn't about replacing you. Not at all. It's about elevating you. As AI gets better and better at the science of medicine, it's really challenging all of us to perfect the art, the compassion, the communication, the wisdom that will always, always be the irreplaceable core of being a doctor.